Joanna and Kathe with the Insurance Business Babes. And today we are going to talk about something that happened to me yesterday, actually. And if you've been in this business for very long, it has probably happened to you too. And what do we do when an insurance company gives bad information to one of our clients?
Hmm.
So, Joanna, let me tell you what happened.
Okay.
Yesterday, we got contacted from one of our clients that
Mhm.
has a Medigap plan.
Okay.
And what happened was she's in mental health right now. She's seeing some kind of mental health
Sure.
professional. And the insurance company called her doctor's office and said that she has no mental health benefits and they've covered it in the past, but they're no longer going to cover it. Is that crazy?
Are you? I don't think it was really the insurance company. I think I would be shocked if it was really like United Healthcare, Humana, or somebody calling saying, "Hey, she's got a Plan G, but it ain't covered." Unless it's not something that's not a Medicare covered service. You know, what I'm saying, like, I don't know, is hypnotism Medicare covered? Is it? We have to look that up. But like,
Oh, I should have asked her, what is it? Because I looked up outpatient mental health care. I've
okay,
got the list right in front of me.
well,
But you're
sure.
right. Maybe, a lot of times, and you're right, Joanna, a lot of times our clients don't know enough to be able to tell us what the problem
Hmm.
is, right?
I wish their phone calls had to be recorded, right?
Exactly.
I'm trying to get out word for word. So they said what to you to do what? I mean, a lot of times, Kathy, I feel like we're like junior detectives and we have to figure out who actually said what, right? And how to actually get it fixed. I mean, and then I had to do this when I worked at Social Security all the time. People would call in or come in and they would just say the most crazy thing and like not put it into, terminology that we understood, and I'm like, okay, so your doctor told you to do what? Or DFAX told you to do what? Okay. Oh, wait, they mean you want, and just, I bet you that either A, it was somebody who wasn't actually the insurance company, maybe a third party. B, it's not a Medicare covered service. But then the doctor should have known if it was a Medicare covered service because they should have 2,000 other people who are on the same Medicare covered billing, you know?
Well,
I mean,
doesn't MACRA require that if it's not covered by Medicare, they have to inform the client?
I think so. We should talk about that because um you know, I have a client on ACA, and he had insurance, Anthem, Blue Cross Blue Shield of Georgia, and his doctor's office is still balance billing him 2 years later for something that was. Now, here's the thing. It was an HMO plan, but if you didn't take that HMO plan, you should have refused service before providing it. It's not the client's fault that you accepted their card, you treated them, and now you're billing them in full because you couldn't get paid by Anthem. That's
It's
they changed the law. You can't do that. You even
it's
have to
just
show how,
crazy.
like, truth in billing. You even have to show them how much those Q-tips at the hospital cost, right?
Amazing. I mean, I remember when it's just crazy, just crazy. So I'm glad that some of these new laws are put into place. But here's the problem. Here's what they do. They hand you a stack. Here's here's what you have to sign, Joanna. Here's your stack of
Yeah.
papers that you have to
Sign
sign,
here, sign here, sign here.
or we're not going to treat you. Now, how many people actually read all that stuff?
Very few. And then most people don't read that. So, and I need to get somebody from a medical billing in on here. A lot of times they say we're going to file on your behalf with the insurance, but if the insurance doesn't pay, you're responsible for that. How crazy is that? Because you think that they're accepting your insurance, right?
And they're not.
They're not.
They're accepting you as a patient, and you are signing that if they make a mistake or if it's not covered or for whatever reason, you're gonna be personally responsible. And so a lot of people don't know that, but what you were saying earlier, I think you're right. I think it probably isn't the insurance company that called and said, "We're not gonna cover this." First of all, it maybe it is hypnotism or something that, massage. Massage is not covered,
Mm-hmm.
whether or not I can get you in that group and you'll see, but it is expensive
Mm-hmm.
for me. And, so yeah, it was a financial planning group. But anyway, back to my client.
Sure.
Let's say that the client was right.
Mm-hmm.
Let's pretend that the insurance company did call her doctor and say that even though it's covered by Medicare, they're not gonna cover it. You know what the first thing I would do is I'd be on the phone with 1-800 Medicare, and I'd be filing a complaint.
Mm-hmm. And the Department of Insurance.
Right, I didn't think of that. Yeah,
I
I'd be
think a
fi
lot of times we try to go to CMS instead of going to the DOI, because the DOI acts very fast on issues, whereas with CMS, I feel like they're so overwhelmed and you might get someone who just sweeps it under the rug instead of filing a formal complaint with a DOI. Like when I see on these on our Facebook group, when people have a legitimate complaint against another agent or against a carrier or someone in our industry, they often think that complaining to the carrier or CMS is going to correct the problem. But who's over the entire insurance industry?
the DOI in your state.
And
Right.
who determines if Kathy Klein and Joanna Wyckoff have a license to sell insurance?
The Department of Insurance does. And
CMS doesn't.
can you sell Medicare, plans without an insurance license?
Not legally.
No, you
There is an
cannot.
insurance group that lost their license. Uh, yeah.
What?
Mm,
What? Okay,
mm.
we'll have to talk about this later, because I would not have I would never I would I don't know, I'm kind of I'm a rule follower
Me too.
on certain things.
Ex-military, ex-federal, you know?
If it is a straight and it is definitely a rule, I will follow that rule.
Mhm,
But if it is a rule that has not yet been implemented,
mhm. Medicare.
that was smart. Very, very
Yeah.
smart.
I think when people just pigeonhole themselves into one product, especially if regulations change in the future, we don't know if CMS is even gonna let us sell Medicare in the future, you know what I'm saying?
4 of them, right? It was JJ,
Yeah.
it was, the football player oh, wait, who was it? It
But,
was
they're mostly owned by the big boys in the industry, like eHealth, GoHealth, Integrity. Those folks own those call centers who are doing all the bad stuff, and maybe they do get fined a little bit. They still profited more than they're getting fined, so they don't care. But if you're not actually punishing them and closing down the entity, what good is it?
yeah. It's not right.
It's
It's not
not.
fair
Mm.
that we have to be you know, I shouldn't have to record my calls and hold them for 10 years, you
Right.
know?
How much space do we need for 10 years of 8 hours of calls a day?
It's crazy,
Guess
and
what?
one other thing,
Mm,
I'm asking people for okay, so I don't just sell Medicare Advantage.
yeah.
I record all my calls
Yeah.
because everything is recorded. If Kathy's on the phone with my phone number, it's all being recorded. I'm asking people for private information
Mhm. Mhm.
that should not be recorded,
Mhm.
in
I
my
agree.
opinion.
Kathy, can I tell you something? When I worked for the government entity for 9.5 years, they said that our calls might be recorded. I don't think they were ever recorded because guess what? When someone called in and threatened to come slash my tires and stuff, the recordings didn't exist. So why,
What?
if the government doesn't have to store their recordings for 10 years, why do individual private agents have to store theirs for 10 years?
Exactly.
I
It's
get
crazy.
maybe 1 year. Like if I sold you an MAPD and told you everything was free, no co-pays, everybody's in network, and then you find out 3 months later in January that I lied, liar, liar, pants on fire, pull the recording. But if I sell you something today in 2023, and in 2030 you decide that that agent from 7 years ago lied, like you should have known that something was not right 7 years ahead of time. You know what I'm saying? Like there shouldn't be a 10-year statute.
Back to the subject of clients not knowing how to explain. What are you doing, Joanna? What are you
Sorry, the vice president of an insurance carrier was calling me and then just texted me. I wanted to make sure he wasn't dead. Back to Kathy.
Back to the listeners and the viewers of the podcast here. Okay, so now I totally lost my train of thought. I forgot what I was going to say. Um, 10 seconds. Oh, I know what we were talking about. We were talking about how clients don't know how to talk to insurance companies or anything like that. And so here's the thing, when I talk to, well, let's say I'm selling a Medigap plan to a
Yep.
client,
Yep.
I always tell them, and they still forget, I always tell them, when you call your doctor or when
Mhm.
you ask your doctor if they accept your plan,
Mhm.
never say the name of the insurance company if you have a Medigap plan.
I like that.
Never say I have ABC or XYZ company. You say I have original Medicare with a Medigap plan, because if you say the name of the company,
Mhm.
they automatically go to Medicare Advantage.
Mhm.
And so
Mhm.
they are thinking, oh, we don't take XYZ company. But if
Mhm.
it's a Medigap plan and they take Medicare, guess what? They have to
Mhm.
take your plan. So many people think that they have to ask, do you take XYZ Medigap plan? That's only for Medicare Advantage. So for those of you that are
Or
listening,
select.
or select, and why do they even have select?
What's the
Like,
purpose of it?
what the heck? I mean, i- if you're an agent, you could easily accidentally sell a select plan
Mhm.
and not realize. So, Joanna, tell them what a select plan is. Basically, for me, it's almost like an HMO, but explain to our viewers what a select plan is.
Yeah, thanks for putting me on the spot.
Oh, we can do a
But
10-second
I
rule.
got this. No, I got this. A Medicare Select plan is a supplement that you can only use in select networks, like select hospitals. So, like here in Atlanta, it would be only like Wellstar or Piedmont, and it's just crazy because it does lock you into a network. But the whole purpose of a supplement is to not have a network.
I know. So why did the government allow the insurance companies to say, "Oh, well, let's pretend like we're a Medigap, but we'll have networks." And you know what? They're not that much cheaper.
You know what? And maybe, well, no, you would never sell your client a select plan.
Unless it was an accident.
Yeah.
Like, you're looking at the list of plans. I have to tell you, yesterday I was working with a client. It was an actual existing client, and they wanted to change to another insurance company. And the select plans came up first, and I almost checked that box.
Mm.
Almost. I was like, oh my gosh, Kathy, you almost checked the wrong box. Can you imagine
I bet it
if I were,
happens. I bet it happens with untrained agents. I bet it happens by mistake. I bet consumers go in and think that they got a lower quote than the agent who gave them a quote over the phone, because that happens all the time when when people try to do their own quoting online and everything. Oh, Joanna, I found something $2 cheaper than you quoted me, so I'm gonna go with this. Nobody really does that to me, but it might be a select plan, you know, and they're not always cheaper.
it wasn't even that much cheaper. It was like $2 to $5
Mhm.
cheaper than the real plan, the real plan that I was trying to that I was trying to get. But, I mean, I was sweating after I almost checked the wrong button.
I wonder if companies actually get enough consumers on those select plans to make the risk pool. Do you understand what I'm saying? Like the risk pool in those plans must be really difficult. Like I wouldn't sell it just because of the risk pool because the rates would go up, right?
Exactly. And then are they able to change the network? Like, you bought it,
Mm.
and it was this network with this hospital, and then all of a sudden,
Yeah.
that hospital isn't in it anymore?
Well,
Like,
like right now, Humana and Piedmont Hospital here in Georgia are at fighting, and Piedmont's sending all these nasty letters out about Humana. But like, if Humana had a select plan, you would lose that network if they don't sign that agreement because it's for all of Humana, right?
I know, and so speaking of, you're talking specific names. Y So for those of you, I don't like to say specific insurance
Sure.
company names, that's just me, but I'm gonna let Joanna. But here's the thing, I had a client about 6 months ago call me,
Mm-hmm.
and she had gotten a letter from her doctor's office saying that they were no longer going to accept Aetna.
Well.
And I'm like, "You have a Medigap plan. Are they not taking are they not taking it?" And she pulls out the letter. And I said, "Yeah, it does say your supplement, but I think that they're wrong."
Mm-hmm.
And these are things where clients need your help as an agent, really
Mm-hmm.
trying to decipher what it is that is going on. And so she said it's right there on the website. And I said, "Well, you need to talk to either the CFO or the person who's in charge of contracting
Mm-hmm.
insurance companies, because this is not right." I said, "They
Mm-hmm.
accept original Medicare, they have to accept your plan." And so she did. She found the person who contracts, and they said, "Oh, no, your doctor should not have sent you that letter."
I bet you it was somebody making $15 an hour who just pulled up all the Aetnas, whether it was Aetna Senior Supplement or Aetna MAPD, and said, "Boss, I sent everybody the letter."
That's right. That's exactly right. But
You ju-
it's funny because on the website of that hospital group and the doctors groups, down towards the bottom, it said, "Medigap, we are still accepting." But of course, it doesn't say all the names because there's a million Medigap plans, right?
Mhm.
So anyway, but yeah, so we need to be the interpreters for our clients, basically. So
Yep, you had to have interpretation language skills. I mean, just like deciphering skills, really, because a lot of times like I had a client Wednesday. She sent me a picture of a letter from the Department of Family and Children Services, and it talked about her food stamps, and it talked in the middle of it. It said that she's no longer going to be what they call QI, qualified individual, for the state of Georgia to pay for her Part B social premium out of her Social Security check, and she was panicking. And I got her on the phone and I was running her eligibility check because I stored her last Medicaid number in my files. And I ran her eligibility check. I'm like, "Did you get another letter? Because this one actually gave you a better level." I'm looking on the insurance screen, and you actually have what they call FBDE, full benefit dual eligible. I said,
oh,
normally when people have this letter, they either do two things. A, they get a check on both the first and the third, and they have full Medicaid because they get a check on SSI, age or disability, or they were approved for a waiver program by their state that gives them the full Medicaid. She goes, "Oh, yes, I was just approved for a waiver. I have somebody come into my house for 10 hours a day." I said, "Okay." So in that letter, they didn't tell you the entire story. You actually have a better plan now, and actually I was able to give her a better advantage plan than the one that she was on, because she was on one that was only covered extra help for Part D. But now she's on a plan that has a grocery card and all those fancy things that they have for the medical people with both Medicare and Medicaid in our state. And so she's tickled pink. But had I not continued to dig, I could have put her on the wrong plan. I could have said, "Oh, you're losing QI. Psh, now you're going to go over to this plan with full copays and stuff." And she wouldn't have had to pay the copays because she would have had Medicaid, but she wouldn't have had the additional benefits that the plan with Medicaid covers, like that grocery card and the massive dental benefit and stuff, right? And the personal emergency response system that she needs, because she actually has a condition she's falling all the time. That's why she has
Oh.
someone coming to the house for 10 hours a day. Is something is making her fall all the time. And but yeah, I helped her get approved for that waiver program. She's like, it took them months. I was like, I know they're not the fastest over there. They're not Speedy Gonzalez, but it is a financial blessing for her because she doesn't have the means to come out of pocket. Because guess what? Medicare doesn't cover, Kathy.
Long-term care.
There we
What
go.
else?
Well, it doesn't cover custodial care either.
Right, long-term custodial. Right,
Hmm.
exactly. Does not cover that, and people, I don't know why they still think it does. And people are constantly mixing up the words Medicare and Medicaid.
Hmm.
Like,
Or the definition of home health care. Home health
yes,
care is not a CNA coming to your house and giving you a bath. Home health care is like basically like wound care, come and take your blood pressure, come to give you a shot, come to do a medical service for you. Bathing, dressing, that's not a medical service.
the problem is sometimes the home health care companies
Hmm.
will do
Yeah,
some long-term care, like they'll help you take a shower
yeah.
as a side, like as an adjunct to
Yeah.
what they're really there for, and so that's why people think
Hmm.
that home health and home care
Hmm.
are the same thing, and they're not.
I actually just had another call. Unfortunately, one of my clients had an amputation this week,
Oh.
and the spouse, they were one of my very first Medicare clients back in 2018. They called me panicking, is our insurance going to cover all these bills? And I said, thankfully, when we met, we kept him on his original Medicare supplement plan, because at the time he had stage 4 of kidney disease. And I said, it's going to progress. One day he's going to be on dialysis. And sure enough, I was right. 2 years later, he's on dialysis. And now he has an amputation due to that, the issue with the kidneys. But I said, that's a decision that I'm I'm glad that we made that decision not to put him on a plan where you have networks and co-pays and services, because now you do get those home health care services. But home health care is not going to come and give him a bath. They're going to come and change the wound, do the wound care and everything. They're going to come do medical services for him. Um, so yeah, I mean, people confuse those all the time, but I'm very happy that such a relief when I got that call that he had the right insurance for himself that day. Unfortunately, the medical, I can never wave a magic wand for their medical complication, but at least risk Medicare insurance is all about risk, right? That's all it is,
Absolutely.
mitigating that risk.
Yep.
Mm.
It's true. And what we do is so important. What we do, what everybody who's watching and listening to this should understand is that what you do is really important. And if you're new in the business and so you don't know what questions to ask, you need to have an upline that you can contact and say, "Hey, the client just said that they lost their Medicaid benefits." You need an
Mhm.
upline that says, "Well, did you ask them this? Did you ask
Mhm.
them that?" You need to have an upline that's gonna help you. Now,
Mm.
I never bother my upline for almost I've always been a renegade.
Mhm.
I always had to find out on my own. And when I started, I didn't know about these Facebook groups. I didn't have any of that. Although it was 2014, so
So
Facebook
they weren't
existed,
the Facebook insurance groups didn't at the time. Or
because you
maybe
were one of the first, right?
yeah, so insurance soup existed when I came into Medicare in 2017, but it was more of like a PNC group. And there was very few people who were saying that they were doing Medicare or willing to share what they were doing Medicare. But that's how I found my friend Malia Rogers and Becky Jennings and John Lyons. And I was sprinkling my Medicare questions just because you never want to overwhelm somebody, especially somebody who's not getting compensated, right? And a year later, less than a year later, I met my mentor, Joe Tratola, who had already created this group, but he was creating it for consumer facing, not agent facing. And so my friend Justin Brock had created his already. And a couple of the life insurance groups are now popping up. Early 2018 is when it was the boom of insurance groups. Like somebody made a final expense group. Someone made a, life tips, tricks, and closes, one of my favorite groups. Um, Justin created the Medicare group. And anyways, we were all sharing information. It was fun because now, instead of just seeing agents at carrier meetings for a brief second after people stop talking, we're sharing from across the country and comparing notes, Kathy. It's actually made the insurance industry more transparent than it was, I feel, because, your uplines used to be able to tell you whatever they wanted because good luck comparing notes to somebody that, that actually knows, right? But now we're like, oh, so and so told you that you can't get this. Well, that's not true, and we're comparing notes from across the country. And now we're actually forcing folks to provide the training to their downlines because when I contracted in 2017, you don't know what you don't know. I'm a smart cookie. I got a master's degree. I worked for the government. I thought that AHIP and the carrier certifications was going to teach me how to do this job. Nobody told me this job was sales. Duh.
That
No,
is so funny.
right? And nobody told me I was going to have to spend 99% of my time prospecting. Nobody told me how many intricate the Medicare industry was, right? Anyways, um my upline at the time didn't have any training. They were just basically what I call a contract house. They got me
Yeah,
contracted. I said, "Hey, how do I set up a table in front of Dollar General like I see this well care company do?" And they said, "You can't do that. You have to buy leads," and that's not true. Um, and
but it
that was what I was finding when I was able to go to the meetings here in Atlanta. Nobody wanted to tell me how to do it because they thought I was going to take all the people that they were talking to. Actually, Kathy, that brings up a good point. Guess how many people I trained yesterday that weren't affiliated with me here in Atlanta?
how many?
35 agents showed up. I trained Social Security training on behalf of WellCare and CenterWell. 35 agents not affiliated to me showed up. And somebody was like, "Well, why are you doing this? What's in it for you?" I was like, "You know what? If I help you learn how to help your clients navigate Social Security and everything, it actually just makes it a better playing field, right? Like it just makes it all easier. But why not? Because you know what? We're rarely going to run into the same client,
I
right?
know. And even if you do, your client is gonna pick the person they resonate best with.
Yep.
And so if I have, let's say I have a potential client and they talk to you and they talk to me and they decide that they want you to be their agent,
Mhm.
I'm like, "Thank you for finding out now
Mhm.
because otherwise I might be butting heads with that person for the
Mhm.
next 5 years."
Exactly.
I've had to fire clients before. You
Mm.
know, I do not let clients, yell at my team,
Nope.
and if I told clients and this is when I was a financial planner and I was making a lot more money per client than I make
Mhm.
now, and
Mhm.
I was like, "You're gonna have to find yourself a different a different agent."
Mhm.
And I'll walk away from clients, like, if I can tell that they're not gonna be a good fit,
Mhm.
I'll refer them to my competition,
Mm.
you know?
I
I
do the
mean,
same
not
with
to be mean,
agents.
not to be mean or anything, I just say, "Here's some other agents that might be a better fit for you, I think you should talk
I
to them."
agree. I've done the same with agents who've wanted to work with me, and I was like, "You're not a good fit for me to mentor you." One of them was wanting to text me at midnight. She's 3 hours behind me. She's part time, and I give her so much time. She just didn't respect my time, and I was like, I just don't see this going well because you're always going to want to take my time at midnight. when it's convenient for you. And I don't have the capacity to give you what you need. I think you're better off somewhere else. And then, she didn't like that. Like, people think that they have the rights to our access to us, and that's not true. We get to choose who we want to work with, whether as an agent or a consumer. And yeah, best of luck to them.
Exactly. Exactly. So I think the takeaway from this meeting that we're having and this podcast is you really need to communicate. You need to train your clients how to communicate.
Hmm.
And if your client tells you something, sometimes you need to dig a little deeper to make sure that you understand what that client is saying so that you can help them,
Hmm.
because that happens a lot in our industry. We're in a very complicated industry, and sometimes clients don't have the right words.
Hmm.
So we need to help them find the words, right?
Agreed. Agreed.
Okay, good. Anything you want to say? You want to give out your contact information before we say goodbye on today's show?
Bye. Thank you.